Do you know how life begins?
The Big Bang?
This is Me-ssion at Night. What's up, dog? Hi, welcome to another episode of What's Up Doc, brought to you by Me-ssion at Night, where we peel back the curtains of medical mystery and deep dive with doctors from every corner of the healthcare universe. Here, we're not just talking about health, we're living it, learning it, where we get insider insights that you can apply directly to your life. It's not just talk, it's your gateway to a healthier life. So let's decode the secrets of health together. Today, we are peeling back the curtains on the lab where life begins.
Joining us is none other than Dr. Liow Swee Lian, the Chief Embryologist at Fertility Centre, Singapore. With over 2 decades of experience in helping families start their most precious journey, Dr. Liow has been at the front line of breakthroughs, from freezing embryos to hand-picking the best blastocysts. He is the baby whisperer of the lab, with steady hands behind some of Singapore's most heartwarming success stories. Whether you're curious about how IVF really works, or just want to know what the embryologists actually do, you're in for a treat.
So let's dive into the world where science meets life with the incredible Dr. Liow.
Hi, welcome.
Hi, thank you. Good afternoon, Tillerson and Matthew.
Hi.
Yeah, good to see both of you. Yeah.
Could you share with us, who are you?
Oh, who am I? Okay.
Yes.
My name is Dr. Liow Swee Lian. I am the scientific director for Fertility Centre. I have been in this field more than 30 years.
Wow.
I did my training in NUH at a time when not long ago after the first IVF baby was born in Singapore. That was in 1988. But I joined the ONG department, obstetric and gynecology department in NUH in 1990. So that time, as a postgrad student, everything was very new. Nothing like was so advanced at this time. So I was involved in a lot of research work, using mouse embryos to optimize the conditions for growing embryos and try to extrapolate these conditions to grow human embryos. And during that time, I'm fortunate to work with my mentor and successfully produce the first ICSI baby in Asia in 1994.
From Singapore?
From Singapore.
From Singapore.
Singapore. Yeah.
Okay.
We and then since then there a lot of doctors and embryologists from Asia Pacific came to NUH for training. So I'm involved in this training of these doctors and embryologists. Currently, I'm also the co-chair of this organization called Aspire. This is what I call special interest group, embryology. I want to co-chair that. We conduct certification workshops for all the embryologists. And this is Aspire, is an international organization for Asia Pacific fertility specialists and embryologists. Yeah.
Wow.
Yeah.
So what is your role, right? And what you're doing now at Vetus?
Okay. My role is, of course, I'm the looking after the IVF program in the Fertility Centre. And in fact, with Dr. Roland, we are both of us are the founders of setting up this centre.
Okay.
Now we just celebrated our 10th year anniversary.
Oh, wow, congrats.
Thank you. Yeah. And the reason why we set up this one is because Dr. Roland and I have this philosophy that we want to help our fertility patients because we see a lack of, quite a lot of patients who are not so successful. And we are using our latest knowledge and advancement in IVF, we will hope to improve the outcome for our patients. Yeah.
Thank you very much for joining our show, man. There you go, ladies and gentlemen, right? It was a great honor for him to come to our show. In fact, we were so curious, why such a doctor of his high-profile country come to our show. And now we know the reason, because he wanted to share all this knowledge to our people out there. So that's it. Really, thank you very much for coming to our show. Yeah. So I'm now very, very curious, because you did mention that you were the first batch back in 1988, right? What got you interested in this field?
Okay, 1988, I wasn't there yet, but I was very curious because since young, when I was a little boy, I was very curious about how life begins. So when I was living in the countryside, I was looking at all those living things like insects or all those things, even flowers, how they emerge, how they evolve, and all those things. So now, when I was in undergraduate time,
okay.
in fact, my background is a veterinary medicine. I'm a veterinary surgeon at this time.
Wow.
Okay.
Yeah. So after graduation, I started off with in a chicken poultry breeding farm, whereby we get all the breeders. Fertilize the eggs and get these eggs and hatch them and the chicks and sell to the farmers. So after 4 years, I said, why not just go for my postgrad and I am so NUH postgraduate. So it's very interesting because this field, what I'm so passionate about is that it's a happy type of profession. And also to see joy in my patients, to have a successful program. I mean, IVF babies carrying, or those unfortunately they have a so-called negative outcome, but they know. From there, at least they know that we have done our best to and they have a closure and then they can move on to the next step.
This is your advanced birds and the bees.
Yeah, if you see in my Instagram logo or WhatsApp logo, there's this picture which I took macro, a bee on the flower. So the flower is a female. The bee carries the pollen. The pollen is the sperm. So the bee is the embryologist who is very hardworking, trying to fertilize. I mean, to get the outcome, get the fruits of the effort. Yeah,
It's just really meaningful, the things that you are doing actually.
How similar is it? Like because you were a veterinarian background, right? So how
Yes.
similar is it to humans?
Actually, similar. I think in the sense that whatever we are trained in is all in the medical field as well. But in the sense that my curriculum was more, I think, diversified, more wholesome in the sense that we study a lot of psychology, sociology, and everything. So, and of course, we handle animals. You have to be psychologists, because animals cannot show how they feel.
Yeah.
You must know look at them, and treat them that way. So, the difference is not much because whatever the doctors in the medical field study, we also study the same thing.
Okay.
Yeah, and the thing is that it broadens my field and make me more in terms of not only focus on medicine but focus on other fields in advanced fields like research field and all those things like that.
And then you, in your opinion, that helped in your current scope of work now?
Yes, it helped tremendously.
So I'm curious, saying that's the case, right? What drew you to setting up Virtus Fertility?
Okay, when I was in NUH that time, so I was as I say, I was involved in all this research in IVF and all those things. In fact, I was also responsible to setting up in the first ICSI lab in Singapore, that is in NUH. Now, what makes me come up, because that time I help my professor to start up the ICSI program and also involved in actually some monkey business.
Making
Real
monkeys,
monkey business.
Okay.
Monkey business in the sense that we use monkeys to create actually clones. But more of a proof of principle. That time, just to find out that when we create the monkeys, they get the cells, and then from especially the embryonic stem cells, to convert them to other cells that can use for future use. Let's say, if you have embryonic stem cells, you can convert it to a heart tissue.
Okay.
So what happens is that in theory, let's say we have this human blastocysts. So these cells here, embryonic stem cells, can use it as a spare. So let's say the man in the 50s, later on, his heart has a problem, we can use these cells to repair his heart.
Okay.
So all those
create
things.
a brand new organ or use it
Grow.
to just...
Just
to
to
grow the
grow
organ
them.
lah.
That time the 3D thing is printed not out yet,
Yeah.
so that's a theory. So we successfully created a few pregnancies from clone monkeys, but unfortunately, that time the science of this cloning thing is reproductive science is still very early stage, and because there's asynchrony between the fetal growth and the placenta growth.
Okay.
So the placenta growth was slower than the fetus. So unfortunately, we had first trimester of pregnancy, we lost all the pregnancies. I always share with my students, had I got one, I wouldn't be in Singapore.
Oh.
That's true.
I will be in those MIT or Harvard or doing
Yes.
some more research work. So because during that period we were doing a lot of this thing, and when cloning, the controversy came about in human cloning,
Yes.
then the funding for research stopped. So
Okay.
my professor and I came out from the university to set up the first IVF clinic in Gleneagles Hospital.
Okay. And that was when?
That was in, I would say, 2004.
2004.
10 years,
okay.
10 years, 10 years anniversary.
Okay.
No, 2004.
Yeah.
That was in
2004,
Gleneagles.
24. Oh,
24
wow.
years.
That was
20
in
years, 20 years.
Gleneagles
20
Hospital.
years.
Yeah, so I was there for about 8 years. Then my professor asked me to help set another center that is in Novena. So I was there for about until 2013, 2014. Yeah, then Virtus came, wanted to set up one center in Singapore.
Okay.
Because Virtus Health actually is a group. So the headquarters is based in Australia. And this Virtus Health, all the IVF clinics, majority of the IVF clinics in Australia, like in IVF Australia in Sydney, Melbourne IVF, Queensland, and so on and so forth, belongs to Virtus Health. And Virtus Health has also got IVF clinics in Denmark too. 2 IVF clinics, one in Ireland, one in UK, and the first one in Singapore. So during that time, I've been headhunted to set up this in 2014. So 2015 is the operation. So Dr. Roland and I have set it up, and now we are in our 10th year of operations. Yeah.
Okay, so I'm very curious now, because I've been hearing all those, set up clinic and all. In my head, right, it just dolly the ship, right? And I want to understand the whole IVF process itself, right? And then where does it reaches you?
Okay, the process is that, let's say, of course, one of the conditions for a couple coming into IVF is that they've been trying very hard to start a family, let's say for about 6 months to 1 year. And then they are not successful, unfortunately. Then they go and see the fertility specialist.
Okay.
All right. So the fertility specialist will do a physical examination on the woman, see whether her womb is okay, healthy or not. And the man will have to provide his sample to see whether the sperm are okay in terms of numbers, or whether the sperms are Olympic swimmers, or how many % of them are handsome, and all this and that, they can fertilize. Because because you need that sperm to be healthy so that it can swim all the way from the vagina through the uterus, through the fallopian tube to meet the egg. So it's a marathon race for all the sperm. Yeah.
Yep.
So along the way, there is, of course, this sperm. Why you look at this sperm is that also whether the sperm along the way in the uterus itself, the uterus has a lot of immune cells. So the immune cells, means are soldier cells. They recognize the sperm as enemies. They will kill some of the cells.
Oh, really?
Yes. So let's say you start off with, let's say, 100 million sperm. By the time the number of sperm that reach the egg, it should be minimum 30,000 surrounding the egg.
Because the lady's body will reject.
Yeah, a lot of,
sperms.
a lot of what they call traps around.
Okay.
You see? So that's the thing. Okay, anyway, that is for thing. Now, let's say the sperm, then the doctor will also look at the blood test results of the woman, whether the hormones for production of the egg and everything is okay, and for the man also. the sperm, testosterone, and all those things. Now, after all this physical examination, the blood test and everything, then the doctor will find, okay, now it's time for IVF. So what happens is that, so the doctor will ask the patient, the lady, on when she has the menses, usually the second day of menses, to come in, and the doctor will provide injection, the hormones, called FSH, that, inject into the body for 10 days.
10 days.
10 days
every
of injection
day.
every day.
Oh, wow.
Very. That's why the husband should really support the wife on this, because it's very painful for the lady.
All you guys out there, you heard that. Heard what Dr. Liow say.
Yeah. So
It's very stressful, by the way.
Now these hormones actually is what they call highly purified hormones. Usually found in the human body for the woman, but because by injecting the hormones into the more into the body, it helps to recruit more eggs out from the ovary. So that and also to facilitate most of these eggs to grow at the same rate. So that on the 10th day, the doctor will between the first day of injection and the 10th day, the doctor will ask the patient to come in maybe once or twice to scan, see whether her eggs follicle, where the egg is, grow nicely or not. So when the doctor finds that the size of the follicle, there's a ball, a cyst that contains the egg inside, grow to optimal size, then he will give the lady another trigger injection. Trigger means and then the 34 hours after the trigger, that means 2 days later, almost 2 days, and then they start to plan for egg collection.
So the trigger is for egg collection.
The trigger is to mature, so to make sure that the eggs are, when they ovulated or taken out, are ready to be fertilized by the sperm.
So they can collect all the eggs and then...
Yes.
Yeah.
So the whole process is like that. So let's say if a woman has menstrual cycle is 28 days, all right? Now, second day of menstrual cycle, to do the injection. So 10 days, it will be day 12 of the menstrual cycle. All right? Then the doctor give a trigger injection. There's a hormone that trigger it. And then day 14, they say that normally natural, the woman is going to ovulate. So before day 14, before the ovulation, the doctor will collect the eggs. The collection of eggs will be in a so-called, we call it the procedure room or in the operation theater. It's a very clean environment. So the woman will be under sedation, anesthesia. All right. And then the doctor will go in through using I'm not going to show you the needle because it's very...
it looks scary.
Through the vagina, and the doctor with the scope will ultrasound scope, and then you will collect the eggs from both ovaries. So, all right, aspirate, and then just puncture the follicle. It's like a bunch of grapes. Imagine a bunch of grapes.
Suck it out, right?
And then the doctor just puncture one grape and then suck the contents inside, and then the tube, and this tube will be passed to the lab, and then from there, the embryologist will look for the eggs.
That's where you come in.
So the process of egg collection usually take about 10-15 minutes. So on average, they say for a woman, around 35, number of eggs collected could be ranged between, on average about 10 to 15 eggs. But it can be more.
Right.
But it doesn't mean that more eggs are good. Okay? It's the quality to me is more important than So sometimes we have women who are unfortunately young, but unfortunately very few egg reserve inside. We may just get only 1 or 2 eggs. But to me, quality
is better and better.
So does that mean that the egg reserves are finite in the lady's lifetime, or?
All right. For in this time, the egg reserve, let's say, you see, for a woman, when a woman is born, the baby girl is born, she has already given a fixed number of eggs in both of ovaries, all stored there.
In her lifetime, right?
In her lifetime. So 1 to 2 million eggs.
Okay.
All of them were very immature, means sleeping there. So by the time the woman reaches the puberty age, let's say start off with 1 million. By then, puberty, she will have lost about half the number, 500,000 eggs. Remaining. Then every cycle, every menstrual cycle,
they will lose.
Now, they will lose because in your biology class, the teacher will say, oh, the woman ovulates 1 egg every month, but it takes more than 1 egg to get 1 egg ovulated.
Okay.
So sometimes the body, let's say the body take out 10 eggs to grow, but only one will grow the largest naturally. So the largest one will suppress the remaining 9 eggs from growing. So that only 1 is ovulated. And then you will ask, what happened to the remaining 9? So the remaining 9 will just die off. Then you lose those eggs. So every month the woman will be losing a few eggs. Okay?
So when you say lose eggs, those are part of menstruation or just suck into the body or?
The eggs will just, the follicles will just die inside
the cells
and then will be removed. Yeah. So now, then then IVF come in by injection. The injection, as I said, the hormone FSH helps to facilitate the rest of this, let's say, 9 eggs to grow at the same rate as the dominant one.
Okay.
So they can harvest or so-called collect
Good size eggs.
all the eggs from there.
Okay.
Yeah. All right. Yeah. So that's the thing. So after collecting eggs from the woman in the tube, then the embryologist come in and then pass the tube to the lab, and the embryologist look for the eggs under the microscope.
So your job was to look the best quality egg out of those eggs collected.
Because we always work with the doctor. We always give feedback to the doctor, okay, whether the majority of eggs are good or not. And then from there, let's say if the quality is good, that's okay. Let's say the unfortunately cycle, the quality of eggs are not so good, then the doctor will tweak the next the stimulation or how we can improve that the next cycle.
So does the doctor, the skill of extracting the eggs,
It's very important. Yes, important. Not every fertility specialist can do that. Let's say
Why? Because they
OBGYN.
damage the eggs?
Huh?
Will they damage the eggs by doing the extraction or?
Well, there are precautions there, like suction pressure and all those things. There's a special needle to go in. So you see, for a fertility specialist, I think you should ask Dr. Roland. Not all the obstetrics gynecologists are allowed to do this. They have undergo training. We call it subspecialists.
Okay.
So they have to undergo training under a mentor, and then from there to take out the eggs and everything. Yeah. So after meeting the quota, then they are allowed to do that independently
On their own.
Their own. This is required by the Ministry of Health.
Right. So when these eggs goes to you in your lab, right, what do you do to them? You evaluate them and then?
Yes, that's a good question. That's a good thing. Now, usually what I do is that, in fact, I say the eggs are collected at 8 o'clock. Half an hour later, I will go in and then I'll take the eggs out from the incubator and evaluate them and see how much time do they need to be incubator to grow further, to mature further. So usually you allow them to grow them about 4 to 5 hours, before you can process them for fertilization. All right, because it's like as I say, it's a bunch of grapes. Some eggs are mature faster, some are very slow. So you must look at the overall. And because when you take out the eggs from the ovaries, the eggs still need to grow, still need to accumulate resources for embryo development. So you, by doing that without removing any of these cells around the egg that nourish the egg, you allow them to accumulate more resources inside. And then later on, you process them and then do the fertilization.
So, to a layman, not so good extraction would damage the cells around, and then therefore, is that what it means?
No. You see, these cells, right? You see the egg, right? What you see, right, is just not like a one ball like that. It actually inside the follicle, you call it the inside. These cells are already there. They are surrounding the egg. There are thousands of these cells. We call it the cumulus cells. These are the nourishing cells. So they will, when the egg is extracted, all these come together as one. So now then when you put into the incubator, allow all this to continue to give resources to help the eggs to mature. So if you remove them prematurely, the egg may not be competent for embryo
fertilization,
development.
okay.
So that's why you needed to prepare them and all.
Yes. Yeah.
So when it comes to your stage, you evaluate, you prepare them,
Yeah.
and then you what's next after that?
The next thing is, okay, let's say I tell my staff, okay, by 2:00, I want to do the fertilization process. So by then the sperm will be ready. Straight away, let's do the ICSI. Or in fact, we don't do ICSI now, which I train a lot of embryologists or in Asia Pacific. I use a modified version of ICSI now.
Wow. What is that?
It's called, in short term, it's called IMSI. Meaning that, in ICSI, you're looking at the sperm at the 400 times only.
Okay.
But for IMSI, I'm looking at 3 times more of that, at least 1,200 times more on the sperm, so that you can see more details of the sperm, so that you can select the most handsome, healthier sperm and before they fertilize the egg.
So to the layman, right?
Yeah.
Because when we went through the process, some of the specialists have mentioned, what does it mean by a handsome sperm?
Yeah.
So maybe you can share why? Because to everyone else out there is the millions, right? But there will be one sperm that makes it, and that's all that enough, right?
Yeah.
But why 1,000 times magnification, and what do you mean by handsome?
Okay, that's a good question. Now, just to let you know about the morphology, the shape of the sperm. The sperm contains the head, all right? The head that contains all the DNA, your genes, the male genes. Then there's a neck. The neck is like a generator, power generator, gives energy to the sperm. And the tail is there to propel the sperm to swim towards the egg. All right? So now what happens is that, now we are seeing more men having, even with good sperm count, having issues with what we call a DNA quality issue. So a lot of, at least DNA damage in the sperm. Now, before I explain further, I'll just let you know. Now, when you were in biology, secondary school,
Secondary school.
the teacher will have told you that the job of the sperm just to get into the egg, fertilize it,
And
that's it, finish. Yeah?
Yes.
But the sperm has a major impact on the outcome of pregnancy.
Okay.
As far as the first 3 months of pregnancy. That is because of the quality of the DNA. So we are seeing more of these men having a lot of DNA damage because of the lifestyle they're exposed to or the environmental issues that they're exposed to all the time. Yeah. So now, let's say for ICSI, you're looking at the sperm as a lower magnification 400 times. You can't see much detail in it. You just look at the head. Yeah. So you don't see, what we do is that, let's say we get a few of the sperm magnified to 1,200 times, then you see bigger, and then you can see like structure in the head, like, holes on the head. We have see holes means that sperm had damaged DNA. We will not use it.
Holes as in bubbles, right?
No.
Oh, just holes.
Literally holes.
Okay.
Yeah, on the head. A depression.
Oh.
Because you look at it, imagine it's a 3D thing. If there's a so-called damage, because the whole DNA is like that one hole, but if something broken in between, there's empty space, there's a sink,
Like
a
a
depression.
dimple. Oh, okay.
All right? So when you look at top, you look at a hole, like a hole on the head. So if you see this sperm with quite a few number of holes, you don't use that. Even if it's a single hole, you don't use it. So you do look for another one that has so-called no hole seen at this magnification. So you assume it's a good DNA. Yeah, then you can use it. Yeah. But then again, yes, this sperm has no holes, so-called, but the neck, which is also important for embryo development, should be like a cylinder, wrong cylinder. But sometimes they have abnormal here and there protrusions, not handsome enough. You don't inject it. Okay? So the reason why we spend so much time on this is because the human egg is a marvelous entity. That is what I mean is that when the sperm gets to the egg, first thing the egg will do is not to become an embryo. It will do housekeeping work.
Housekeeping work?
Yes.
Kick out the fellow.
Meaning that if there's some slight damage in the sperm
Not handsome
DNA,
enough, kick out.
the egg will use its limited resources to repair the sperm DNA first
Okay.
before it becomes an embryo.
Okay.
All right. But if it's just 3% less than 5%, no issue. The egg will correct all the mistakes, then give rise to a healthy embryo and possibly a healthy outcome. But let's say if the sperm had more than 10% of its DNA damaged, so the egg will need to use more of its limited resources
To
repair, but most of the time cannot repair 100%. It still needs to become an embryo. So because sometimes more time taken, so there's a delay in what they call the embryo development cycle. So each stage will be 24 hours, but it may take longer than 24 hours so there's a delay. So in that sense, there's a delay. If there's too much error, then the egg will say, oh, I've used all my limited resources up to day 3. All my embryos arrested, cannot reach the blastocyst stage. And as I say, some of these embryos manage to reach the blastocyst. But because of there's still some defective genes contributed by the sperm in that blastocyst. And if it implants, the woman gets pregnant, then she has a high risk of miscarriage and pregnancy loss the first 3 months. So this is very critical. So over here in Virtus, we are seeing a lot of patients who have failed cycles many on other places. And we notice that, and that's why we do IMSI for all the patients. And we have I was happy to say that we have good outcomes for our patients.
So, in fact, I wanted to quickly jump in also on some of the terms because you mentioned that maybe the audience might not know, like ICSI.
Yes.
Maybe you can explain what ICSI means and blastocysts.
Okay, sure.
Yeah.
Yeah, I come across this. Now, ICSI or ICSI. Now, it's what they call abbreviation for intracytoplasmic sperm injection. Simply means injecting one sperm into one egg.
Okay.
All right. Now, let's explain more like IVF. Now, for layman IVF means assisted conception. In clinical term, means IVF means you take the egg and the sperm, put them in the dish, and fertilize them outside the body.
In the dish.
All right. Okay. So that's the thing. So initially, the first baby born, like Louis Brown, was from IVF. Yeah, and because not all men have a good sperm and or the egg quality may not be good. So IVF has a limitation. All right, IVF based on good sperm count and good sperm motility, mean how many sperm able to move and fertilize the egg and all those things like that. Now, then the ICSI came about because there are men who sperm cannot fertilize the egg naturally. So we developed this using fine needle. The needle is very, very small. I think as thin as a hair. All right.
Oh.
Yeah, and using that to capture the sperm and select the sperm under high magnification, that is at least about 400 times magnified. And from there, you inject the egg into the egg. By injecting into the egg, that means you make sure that the sperm is inside.
Yes.
So this sperm will have at least 70% chance of fertilizing this egg.
Oh, it's not 100 already.
Of course, this is on average.
Okay.
Now, of course, let's say out of 10 eggs injected, at least 7 or 8 fertilized.
Right.
But sometimes, of course, that's the average. You can have a range of 100% or less than that, depending on the quality of the egg and the sperm. Yeah. So this is called ICSI or ICSI.
Okay.
And then when it comes to blastocyst, now blastocyst means is the final stage of embryo development before it implants into the womb. So let's say now, today you do ICSI. You get the eggs out from the woman and the sperm from her husband, and you fertilize them today.
Okay.
So the next day you check for fertilization. So that time the fertilized egg will just only one cell. Okay. Now over the days, like second day, third day, from the second day, it will divide into 4 cells. Then third day, 8 cells, and so on. And then on the 4th day, becomes a clump of cells called 16 to 32. And by the 5th day, all these embryonic cells will differentiate into 2 groups of important cells.
Okay.
So one blob of cells, about 200 of them, will give rise to the baby.
Oh.
The other group of cells called the trophectoderm or trophectoderm will give rise to the placenta and helps
okay.
in the implantation. So even in natural body, the woman, all right? So the fertilization happens within the tube. So eggs ovulated, sperm go in and fertilize that. And then after fertilization, the embryo will need to travel down the tube. So it takes about 5 to 6 days to reach the uterus.
The fallopian tube, right?
Yeah, fallopian tube. So by the time it reaches the uterus, it has become a blastocyst.
So it takes 5 days to travel down.
5 to 6 days to travel down.
Okay.
And then from there, it will implant into the uterus, just like planting a seed.
Then they start to grow from there.
Yes.
So I mean, as someone who went through this process,
yes.
There are some people who say, day 3 is good, day 5 is better, or they have two camps, right?
Yeah.
So what should we know?
Okay.
Yeah.
Now, I think what I would say is that it currently, with all the advancement in technology and also knowledge, in fact, we know what of the genes that trigger each stage of embryo development.
Okay.
What are the nutrients required? So the gold standard for every IVF center in the world, it should be a blastocyst.
A blastocyst, which is a day 5.
Day 5. Yeah, you must reach a blastocyst. Even with one fertilized egg,
okay,
you should reach a blastocyst. That will tell you how advanced, how good the lab is. Now, if the lab says that, we still do day 2, day 3 embryos, 4 cell or 5 8 cell stage embryos, that means that their level of skill or confidence in trying to grow these embryos to blastocysts is not there yet. All right? And then they always, 20 years, 30 years ago, if they say that, yes, I believe them, because that time the advancement is not so good. So whatever you put into the uterus is the best environment for embryo to grow, because you have all the growth factors and nutrients there. Okay. Yeah. But you see, the thing is that you should grow the blastocyst. The meaning is that because why? If you were to transfer a day 3, which you have gone through before, and the woman will have to wait for about 14 days to check her whether she's pregnant or not. That 14 days is very agonizing for the woman. Right? You're not sure whether she will get a chance to implant or get pregnant or not.
This is during the IVF
during
process.
the transfer IVF process,
Okay.
you put the embryo in.
Okay.
But if you have a blastocyst, the day 5 or day 6, the blastocyst is already a stage of embryo that has overcome all the difficulties as it starts to grow from 1 cell day 1 to day 5, the blastocyst. So by then, you should be as healthier than the day 3 or day 2 embryos. So when you could reach that stage, if you put it in, there's a good chance the woman can get pregnant. Implantation. That's what you see.
So just now previously you were saying, find a handsome sperm and things like that, right? And of course you mentioned that even though people are younger now, right, there might be some deforms in the sperms, right? So I'm very, very curious, Dr. Liow. No, in our current lifestyle, we have people who drink.
Yes.
We have people who smoke.
Yes.
We have people who stay up late.
Yeah.
Right? Which is the worst?
In fact, all 3 of them.
Oh, really?
Okay. Now, there are causes for sperm DNA damage. All right. Smoking is very, very bad for the sperm. Okay. Yeah. Even you don't smoke, but you are surrounded with all those men passive smoking.
Yes.
That is even worse. Yeah. Now, second, alcohol consumption. Now, if too much alcohol consumption, of course, that is also cause damage. Then the another cause for all this sperm DNA damage is the pollutants in the environment. So of course, Singapore air is quite good. But if you are in those polluted cities, you see a lot of these men having this issue. Yeah. But in Singapore, what I always say is that those in occupations like in chemical and oil industries, the mechanics who will do maintenance in your car, they absorb all these volatile
Chemicals and all,
that can cause damage. And then the last one is radiation. Radiation, of course, the chemo, all those things, of course, can cause. But in those in occupation, I see more in men in the IT industry as well as those in the airline industries, the stewards and the pilots.
The myth. Yeah, so when you say that, right, that radiation, the myth that we heard most of the time is that, people in the IT line or the pilots, they can
Pilots
only
have,
have like female, like only daughters and not son.
Not really true.
They
Not
just
true lah.
can't have.
So it's not the myth, right, where they only have daughter and son. No, but in fact it's just having kids in general. Is that right?
Yes, correct. See, now even let's say now engaging in a recreational sport like cycling, every morning sometimes you see men wearing sexy tight pants,
Yes, tight pants, right.
cycle for 1-2 hours in how many tens of kilometers. Wow, on the saddle itself, it heated out your growing area.
Oh, so that impacts too.
That's impact also because for good sperm production, you got to be at least 2 degrees cooler than the body temperature. All right. Okay. And with prolonged exposure, all those things, I mean, it means once a week or twice a week is okay. But if you do it regularly, too many times in a week, then it may affect the quality of the sperm. Now, another issue also, like nowadays, most of us are now working in front of the desktop,
Yes.
spending a lot of time sitting down.
Right.
Okay. Now, imagine that when you sit down, it warms up that area, the growing area.
Yes.
All right. Prolonged sitting for more than half an hour, 1 hour, every day can cause damage to you may not see very significantly in terms of it, but the DNA damage may be affected there.
Right.
All right. So I always advise my patients that every half an hour, 1 hour, if possible, just step out for a while, walk a bit or somewhere. Yeah.
I still want to have kids,
And at home wear boxers or don't wear jeans that are tight, all this thing can sort of warm up too hot for the sperm to
Cook the
produce.
sperms.
Right.
Like going to onsen all the time or sauna may cause damage if all the time like that. Yeah.
So swimming is good because
swimming
you're
is good.
perpetually, swimming is good.
If you wear too tight trunks, then maybe not lah.
No, the
Better you're
swimming
in
is
the
still
water.
okay lah. Water is water.
So on that note, I'm curious. So because with such a lifestyle that we have today, right? If let's say a young couple want to start a family, right? All these vices that you just mentioned, right? What is a good time or time frame that they should stop before trying?
I would say though, it depends. Let's say like smoking, of course, ideally they try to stop it, but it takes a long time for the body to recover. Yeah. Now, the reason why all these causes like smoking, high temperature and all those things that, like especially for smoking and drinking and the pollutants, what happens is that in the environment like this, what's so called the impurities that we breathe in and consume or whatever inside, the impurities will in the bloodstream will generate what we call a free oxygen radicals. Yeah, they call it free oxygen radicals. Radicals, bad already. So these radicals, they like to attack DNA of any cells in the body, including the sperm.
Okay.
So the body has a tolerance level of trying to maintain that free oxygen radicals in the body. But once it goes beyond that, it causes damage to the DNA.
I see.
That's why it goes in and damage, and you can see holes on the head. So what you see from the sperm, because sperm you ejaculate out, but you don't see what other cells in your body are damaged. Yeah.
So it's important to not just know that the volume of sperms is critical, right? The quality is also important.
So that's why when we do semen analysis, sperm test, now there are two types, what you call semen analysis. Semen analysis looking at the concentration of the sperm, how many sperm you have, the sperm count, then the how many sperm are fast swimmers, how many sperm don't swim. And then we look at the vitality, how many sperm are alive when you ejaculate, because there will be some sperm that are dead sperm. So if you go below that WHO parameter that is 54%, then a lot of sperm are found dead, then there's a warning sign. Then the doctor will go in and find out what could have caused this sperm to die. Yeah, there could be other things, yeah. And then, of course, the shape of the sperm, how many percent of the sperm are handsome. So WHO has this 4% minimum. Anything below that, then the sperm may have not enough healthy, handsome sperm or Olympic fit sperm to go and fertilize egg naturally.
So that's a big factor.
That is called for this semen analysis, it's more of a quantitative analysis, not qualitative. So we over here in Virtus, we include the DNA test, which is a qualitative test. So what happens is that when you submit a sample, a certain volume of this sperm sample will be treated with chemicals to break down the membrane of the sperm head so they can spread out the genetic DNA around it. So it forms what we call a halo. Imagine it's a black dot here. There's a halo around it. All right? The size of the halo can tell you the quality of the DNA. So the large halo means this sperm has good DNA. Then you have some sperm has a very small halo. Small halo means more than 50% of the DNA have been damaged. Some no halo means 100% dead sperm. So what happens is that the embryologist in the laboratory will look at in the field 300 to 500 of this sperm, generate a relative percentage. So the relative percentage of sperm that has small halo plus no halo will give you an index. It's called sperm DNA fragmentation index, or in short, DFI. So there's a certain percentage. So of course, ideally, we want to reach to 1% or 0%, but I can tell you no man can achieve that. Even if he lives in paradise or Shangri-La, good life, good food, you'll still be a certain percentage because there will be dead sperm. So the higher the percentage, that means that more sperm had been damaged. Then this one helps to guide the doctor to sort of treat the man with supplements or counsel the man on the lifestyle, cut down on smoking, drink moderately, and all those things, cut down on fried stuff and all those things like that.
So guys, I'm going to ask this question, right, for all of you guys out there, right? So just like you did mention, you go to a lab, you go and test it out, right? There was another myth out there, that, in order for you to have healthier baby, higher sperm count and things like that, right? You should stop ejaculating a few weeks or days or even months on that,
Abstain.
Yeah, abstain from it,
it.
How true is this?
To me, it's not true. Let me give you a historical perspective first, yeah?
Nice history, no?
Yeah. In the first, let's say the first IVF first started, all these men, because the doctors and the scientists there at that time, they worry about, not enough sperm to fertilize the egg. So they asked the men to abstain. No sex, no masturbation, at least 3 to 5 days before.
Okay.
So that you can produce more sperm to fertilize the egg. All right? Yeah. But that time, of course, there is more of IVF. And IVF also doesn't make sure that, doesn't guarantee that a healthy sperm can go in. A healthy one can still go in and give all this problem. Now, the thing is, you just look at it now in a reproductive sense. Now, the man has 2 testicles, and then there's a pouch on the testicle that store the sperm, and then there's a duct to call transport the sperm out, pass the 2 secretory glands, and then through the penis and come out as semen. Yeah. Now, if you open up the testicle actually is open up, formed with a lot of tubes inside, all connected very nicely. Inside each tube, you take a piece out and dissect it. There's very active sperm production there. All right. Now, the sperm is produced from a single cell. All right. It takes about 70 days for one to differentiate into a sperm. All right. So in that tube, in that testis, so once the sperm are formed, the sperm will migrate and store in this organ just beside it, beside the testicle, attached to it.
Right.
That organ there. Now, then the sperm will be stored there for 1 day or many days until you ejaculate.
Yeah.
Yeah. Now, the thing is that organ has a lot of blood vessels. Okay? And the blood carries a lot of impurities like free oxygen radicals. Now, the longer you store the sperm there, these free oxygen radicals have more chance to damage the sperm DNA. And also, if you store, let's say some men say, oh, why we store for 1 week, 2 weeks, more sperm better. But those older sperm will start to die. And they die, they release some toxins in there, they kill more sperm. So that's why now, in fact, most of the labs, unfortunately, still ask the men to abstain 3 to 5 days.
They do.
But over here, in Matthew, you know that I'll ask them to, if possible, ejaculate every day. Clear every day. Clear every day. That
Clear
is
every day.
Clear
Wow.
every day. But of course,
You very happy, are you?
clear
I'm
every day.
just asking, so guys out there you go, clear every
clear
day.
Clear every day if possible. I mean,
Possible.
but
Okay.
of course cannot, because now the thing is that the sperm production is 24 hours, 7 days a week.
Yeah.
So continuous, all right? Now, of course, if let's say the man comes in to a woman, perhaps the wife has started the IVF program, then I ask the man to come in to every day ejaculate, and then by the day after egg collection, ask him to produce. He may be too tired, he cannot even
Yes.
produce.
Yep.
All right. So usually what I tell my patient is that, well, I give you a schedule to do it, a plan. Yeah. So let's say if you know that you start when the wife starts the injection, then you ask the clinic, what's the estimated date or time, date of egg collection?
Okay.
Then you work backwards. So 7 days before egg collection, clear your sample by masturbation. Then you work 3 days closer to the egg collection day, clear one more time. Then the night before the egg collection, before you go to bed, clear it. Then the wife will say, will there be enough the next morning?
Yeah, I wanted to ask that too.
No. So next morning, we'll ask him to produce. So now what I want is more quality, not quantity. Because we are doing IMSI or injecting the sperm into the egg.
Yeah.
Right.
Yeah.
So you don't mind that there's no very little quantity. What you want
Want
is
to get
very
rid of
good.
all
yeah.
quantity.
Yeah. So that's why now with this type of protocol, we have a successful outcome also.
So it's very, very different from your natural birth, where that's where you need more quantity in that sense.
Yes. And
I
as for
see.
how you were saying that, let's say the man has this high DNA damage, how long does it take to recover?
Yeah.
Now, the doctor will, okay, let's say if the man smokes and then cut down on his smoking, it may take at least a few months to a year. And then with supplements, antioxidants like vitamin C, vitamin E, or CoQ enzyme 10 to help to, improve the sperm quality along the way. So if the man could, let's say first the test was, let's say, about 30% of the sperm DNA damage. Then maybe after 2 months of treatment, maybe come down to 20. Then maybe we can start already. Or sometimes later on when you ask Dr. Roland, what happens next? Yeah, we can go to the source to get the sperm.
Yeah, but that's not what
That's
you
very
want.
Another topic for
painful.
another doctor.
That's very painful.
So
yeah.
if you don't want to go to that source, but you don't like people to poke into your source there, which is quite excruciating. Of course, with anesthetics so be okay. Then try to live a healthy life lifestyle
Okay, so when you say live a healthy lifestyle and things like that, another question that came to my mind, right? Because when you talk about giving birth and all, both male and female, all the healthy things that we talk about, eggs and all, then came to the next question, which is stress, because the couple usually wants to give birth to a kid and then tend to have stress, counting the days and things like that. Does stress come in as a very important factor in producing babies or even in IVF itself?
Yes, it is. Because stress always, both partners, all right? Now, let's say, the woman wants to start a family already. Yeah. And then she was so stressed, you go to the, let's say, a pharmacy, get the ovulation kit and tell, darling, I'm going to ovulate today. We must make it.
Yeah.
Then the husband also got stressed.
Yeah.
Because it's no more like a natural bonding type of sex naturally. Like you look at it as a task.
Yes.
Yeah. So I would say the husband will become the egg slave.
Yes.
Yeah. Performance will not be there, and the wife will be very stressed also. Yeah. And then again, we cannot follow strictly on, let's say, the ovulation. Let's say the woman has 28 days in the menstrual cycle. Day 14 is ovulation. It doesn't mean that every time day 14 the woman will ovulate. The woman can ovulate 1 or 2 days before. or 1 or 2 days after.
I see.
So what I always advise my patient is that have regular sex. Don't wait for ovulation. When you feel like having sex, just go ahead.
And be relaxed about it.
And relax about
Don't
it.
stress
And,
over it.
Go for holiday and relax and come back. You will be pregnant, Yeah.
So that explains a lot to all those people out there, trying for kids. I know it's tough, it's stressful, right? But you have to be relaxed about it. You have to enjoy the whole process.
Yes.
Yeah. So on that aspect, now that we talked about, having the guy and the girl, when we talk about, having handsome sperms,
Yeah.
right? What about awesome, embryos, eggs in a sense then?
Yeah, eggs also, okay. Now, eggs also has a different type of quality that we have. Now, of course, when we look at the egg, let's say the egg is ovulated, we call it a mature egg. Yeah, mature egg means just like a fruit.
Yep.
All right, fruit is just ripe, just nice. Yeah, some fruit are unripe because you cannot use it. So the eggs being mature means you can't use it. They haven't reached that stage for fertilization, so you can't use it. So mature fruit, you can have different types. Yeah, eggs you have different mature fruit. Yeah, some is overripe, some just nice, and some of them with worms inside, or some with something inside. So type of fruits. Yeah. So in the egg itself, you can have a mature egg, and there may be some. Of course, ideally, we try not to have any defects in the egg itself. So there are certain defects that can tell us that this egg potentially could give rise to, let's say, embryo that has abnormally genetically embryo, meaning that it will not give rise to a healthy embryo or a healthy outcome. And if you put it in, there's a high risk of pregnancy loss or no implantation at all. So we are very for us is that, to us, when our philosophy is that you start with good egg and good sperm, we expect a good outcome.
Right.
So, but just let's reassure most of our ladies here, if you majority of the eggs will be okay, unless she has some maybe hidden clinical issues that the doctor have not found out yet. Yeah.
Well, actually quite shack. I mean, he just did mention that, most of the time the ladies are okay, right? The guys, right? You guys need to be more careful and all. And then yet during the whole IVF process, right? The needles are usually towards the lady itself to prepare the egg. Well, actually it's really very painful and it's really very tough on the couple itself.
Yes.
Yeah, it's just stressful, by the way.
But I'm happy to say that the husbands nowadays are very supportive. They really supportive of the wife. Some of them they feel the pain that the wife's going through. Yeah. So I say I remember one telling me that I'd rather do the injections than letting her do the injections, to get all these things. But
doesn't work that way though.
Yeah, doesn't work that way though. Yeah.
I think one of the major concerns, right, as patients will also be, I think, in terms of mix-ups in the lab, how does Virtus help to mitigate that or zero-rise that risk?
Yeah, that's a very good question. In fact, this is one of the important criteria for a well-run lab. Now, of course, in all MOH has already given this guidelines, right? That you need to have double witness system, 2 nurses, 2 embryologists. Now, starting from egg collection up to embryo development, everything, the whole process, every step of the way. Now, first, what I mean is that, let's say, the eggs before process for fertilization, this is this is the patient A. And then after that, you must get the right one, patient A sperm. So patient A, the one who handle the egg, okay. Then the next embryologist will look at it and then countersign. Both of them have to initial. Then the sperm comes in, both of them make sure that it's the patient A's husband. All right. Now, the thing is that we always talk about human error. Things can happen. So what we do is that when we started this IVF clinic, I think we are the first one in Singapore to introduce electronic witness system. Yeah, in terms of meaning that, you see, in every stage, the dishes that contains the eggs or the tubes that contain the sperm, up to the freezing and storage, they're all tagged with radio frequency ID tag. And this radio frequency tag is linked to both the husband and the wife. So if the couple comes to our lab, our center, what happens is that each of the male partner and the female partner will issue individually a white card, so-called, this is an electronic card. All right. And then later on, they will link both. And then from there, every step, if let's say if that happened, let's say in the workstation, in our lab, there's a reader inside the lab. So the dish have to place into the reader, the area that is the reader is. And then let's say, unfortunately, what the embryologist took a wrong sperm sample. Before the sperm could reach the egg, inside there, the reader, the sense, this is not the right sample. It will sound an alarm.
Wow.
Yeah. All right. Then the mistake will have been recorded. Every step will be recorded. Who handled it, when one will come from. And then, but fortunately, it didn't. Because of the alarm, the sperm was taken away and then found the correct one and then go in. Sample. So this is a preventive.
Okay.
Yeah, very important. So that's why we invest a lot on this. Yeah. And also now we are growing the embryos in a so-called time-lapse incubator. Yeah. Where we can review the development of the embryo without the need to take them out. So there's a camera that record all these things. So inside the incubator, they have 16 compartments for 16 individual patients. But each compartment is well separated. And they have the RFID and the QR code each attached to that. So there won't be any mistakes.
Right.
Okay. So if I'm not wrong, the video is also available to the couple, right? To see whether the egg grows.
Yes. What we do is that at the end of it, let's say if the couple has some good blastocysts, they'll be frozen. And then when she comes in for the first transfer, or even before that, we will download all this development of these embryos videos of this blastocyst into the thumb drive and pass to the patient. All right. And also, but with this video also, we can also, let's say, unfortunately, the outcome was not successful. We can use this video to discuss together with the doctor and the patient, and then we review this video and show them what could be the reason why the embryos couldn't reach there.
So that's the growing of the embryo, but not the what's it called, the MESSION, right?
No. IMSI is before that. So after putting it,
but we don't record the IMSI.
No recording of that.
Okay. It's only when it's fertilized already and then
growing it. From there we can see how the embryo grows, and then from there it helps us to select which embryo will be the first one to put in to give you a good chance of getting an outcome.
And so speaking of embryos, can we in Singapore choose the embryos in terms of gender of the baby, or even, I think nowadays you have this thing called the pre-genetics, right? Testing.
Okay. Yeah. Now, gender selection is not allowed in Singapore strictly. Okay. Now, what you're saying is that selection using what I call pre-implantation genetic testing. Now, or in the olden term was PGS, pre-implantation genetic screening, where you screen for all the 46 chromosomes in the embryo. Of course, you have 22 pairs of what they call the autologous chromosomes and one set of sex chromosome, either X or Y. So you, of course, when you do that screening, you see whether the embryo has XX, which is a girl, XY is a male. All right. Yeah. So that one, what they call PGTA now, pre-implantation genetic for aneuploidy, is really allowed to be done in government hospitals, not allowed to do in the private, unfortunately. We are allowed to do only those with mutation or some defects in the chromosome. Mutation like thalassemia or other serious mutation that we can help to select the embryo that is healthy so that the next generation will not carry that
But that's not
mutation.
offered to the couple right at the onset, right?
No, that one is only when a couple has a history of mutation. But for the screening, normal screening, even if in the government hospitals, they will not release tell you the embryo whether it's a boy or girl, right? So gender selection is not allowed. Yeah. Unfortunately, most couples will want to go over out Singapore to do it. Yeah.
So I think on the aspect, also I'm very curious because I think age plays a matter as well, right? There are no myths that people who are above 40 and all you shouldn't, or in fact 35, then there's more risk of unhealthy babies and things like that. What's your take on this?
Yeah, okay. Of course, IVF doesn't guarantee 100% healthy babies. That the unhealthy ones could be random, even for young couples also. Now, for let's say PGS or PGTA, for screening, I think for us here in Inverters, we don't strongly recommend that, even for women who are in the advanced age, meaning 40 and above. Yeah, okay. That is because we only doesn't really make sense to pay so much, and you need the most you get only probably about 60 or 70% of diagnosing this embryo being normal. And what we recommend usually are those patients who have a history of recurrent miscarriages, or recurrent miscarriages meaning that every time she conceived naturally, she has a miscarriage, or we put in the embryos, she has a miscarriage, or most of the embryos cannot implant, even they have nice blastocysts, nice embryo. Then we can recommend that. Yeah. Otherwise, we don't. And I'm happy to say that women who are in their 40s, 40 to 40, have a good outcome without doing all this screening. Yeah.
Okay.
Yeah.
So on that aspect itself, I'm curious, what do you wish that actually patients knew, right, before stepping into lab or even starting this whole IVF journey itself?
First thing, what I would like to let the patients know that not every IVF lab is the same. Okay. The second thing is that at least 70% of a successful program comes from the lab. 30%, 70%, 70,
Wow.
and 30% comes from the clinical component. Yeah. So as I said, not every lab is the same. In terms of getting the A's, handling all these things. So it all depends on the individual laboratory, how they handle the protocols, the training of the staff, and everything, and the conditions of the laboratory. Yeah. The second thing is that if you possible, try to start a family as early as you can. But because now, with all this career, the ladies, of course, they start later. And the myth, and don't follow those superstars or celebrities. Oh, I have babies at 50
years
51.
old.
Those may not be
Ideal.
ideal.
Okay.
Yeah. And the fourth thing is that don't try to get more information if you want before you start the program from the experts or people in the know. Try not to get all this information from social media, if possible, like this Dr. Google, who can get all this information.
Dr. Google.
Yeah.
Dr. ChatGPT.
All those things, because all this information are very generic. And it may not be catered to your needs. And it causes more anxiety and confusion in the end. Yeah. So that's what I can say. Yeah. So another thing is that believe in yourself, that you can overcome this obstacle.
So you guys out there, you all heard Dr. Liow say, right? Please follow, don't stop smoking, start your family early, right? If you forget, rewind this whole thing and watch again.
Watch again. Yeah. So, in your opinion, what are some of the exciting innovations on the horizon for fertility, the fertility industry?
Okay. Yeah. In fact, now the some of the innovation that I have been doing now is, of course, looking. Well, we have first thing is the IMSI. That's the eggs and sperm looking at very high magnification without using any software. Yeah, beginning they will use the software to use it, but I don't use that because to me, it doesn't really work.
Okay.
So I work with my microscope company to optimize all these conditions.
True
so that's
results.
one. Yeah. Secondly, you look at the egg. Now, you look at the internal structure of the egg, meaning the one that responsible with all your genetic material is handling, how healthy that structure inside, without damaging the egg at all. Using what is what they call a polarized light microscopy. Just like in photography, you have this polarizer and the light goes in. So then from there you can see in the dark background, and then in the egg you see a white spot. And by looking at the white spot, the shape of the white spot, the intensity of the white spot, you can tell whether this egg has a good potential to give you a good outcome. Because some eggs, even though it looks very nice, inside the white spot disappear. So all this is another technology. The third thing, of course, is the time lapse. Yeah, that we adopt now. Time lapse is a closed system, meaning that before time lapse came about, it's what they call is open system, whereby the embryos are grown in the shoebox incubator. So to check for progress, you have to take them out, put under a microscope, and then check and then put them back. Now, each time you take them out, you're exposed to this suboptimal environment. The more times you take them out, you cause stress to them. So it will affect the development and maybe cause more of these embryos to become genetically not healthy. All right. So by using this time-lapse incubator means it's a closed system. You not need to take it out.
Right.
One thing. And then because there's a camera on each of the droplet in the well that the embryo is growing, the camera every 10 minutes will take a snapshot. So over time, from day 0 to 5 to 6 days of development, in the end, the incubator will compose all these shots into a video, so that it helps us to also review which embryo that we can have a good chance of implantation, giving a good outcome. Even before that, let's say one of the patients say, "Can I have a look at the quality of a day 3?" Okay, can. We just go in real time and just say, "Okay, this is embryo development." Okay, right. Can tell them.
So this video will form part of the assessment of choosing the eggs as well, right?
Part of it, yeah, it helps. Now, of course, there's another latest one. You hear so much about AI, artificial intelligence. Now, currently, the incubators are incorporated with AI in there, but AI is just a tool. There's still a lot of further development of this AI into that. Yeah, because there's a lot of restrictions in there at the moment. So we don't rely AI to check. The best tool to select a healthy embryo is human intelligence. Still. Okay, yeah. So these are the three, and then the next, of course, hopefully in the future, I'm sure you heard of in small in animals research work. Especially for men. They say some men unfortunately cannot produce sperm, so the sperm cells just stop at certain stage, cannot reach a sperm that can swim, the head and neck and everything, just a round cell. Now, what happens? Or some man doesn't have any sperm cells in his testicle. So the possibility is that you just get a sample of the skin cells,
And
grow them, and then to a very infantile stage, very low stage, young stage, and then bring them into a stem cell stage. From there, using stem cell, convert them to sperm cells.
Wow.
And use that. So it has been very successful in the mouse model. Yeah, mouse model is not as complicated as in the human. And And this is still had to go for human. You still have to go through a lot of research, a lot of ethical issues, overcome that before you can use that.
I mean, with medical advancement, this should be coming soon, right? You never know when they will just break through, I guess. Yeah, so to you guys out there, right, don't lose hope. You never know when it will come your way, right? Technical advance is just wow. Yeah. So I think when you talk about that, I'm just curious on one part of it, right? It's that, nowadays we hear people do fertility preservation.
Yes.
Right? What's your take on this? Do you encourage? Do you think that it's good?
I think fertility preservation, I think, is more relevant for women for egg freezing. We call it social egg freezing, or we can also call it elective egg freezing. Now, the government is kind enough now to allow social egg freezing in July 2023 onwards. Yeah. For women from 21 years of age up to 37 years of age. Now, as you know, the eggs has been in there in the woman since birth, right? Over the years, the woman, the quality of eggs will be affected by what the woman is exposed to. The quality of the egg and everything will be damaged, whatever. So the younger the eggs, the better it is. So let's say for single women or those couples who have no intention to start a family yet, they can freeze the eggs, and store them. So once the eggs have been frozen, they are suspended in time. They will not get any older. So let's say, for example, if a woman is 33 years old, she hasn't found a partner yet. She freezes her eggs, okay? And then by the time she's 38 years old, all right, or even 40 years old, she found a partner and want to start a family. So if you compare a 33-year-old egg and a 40-year-old egg, we are with the same number, same looks like, externally looks the same quality. The chance of getting a healthy pregnancy is the 33 one than the 40. All right. So as I mentioned, freeze the eggs as early as you can, and then from there, it's an insurance.
Yeah.
It's an insurance. Yeah. And or for those couples, let's say they are married in their 30s because of career and everything, they don't want to start a family yet. They can also create embryos to store the embryos, called embryo banking. So the embryo will be as old as the woman at that time. Yeah. So that's one. As for male, fertility preservation is more for medically indicated preservation in Singapore. Whereas for, I think, outside the country, the man, let's say a single man, they don't want to, haven't got a girlfriend or whatever, they can still preserve the sperm, but I don't think it's necessary. But if the man is 50 years and above, it may have an impact on the quality on the quality of the sperm, and also based on medical reports, you have a higher chance of getting child with autistic child. Yeah.
There you go, guys, right? Get your insurance, right? There you go. The myth has been debunked, right? By Dr. Liow, right? Yeah. So, I have so many questions I want to ask you, Dr. Liow, actually.
Sure.
Right? But we have that limited time today, right? I'll probably invite you in other sessions. But let's say before we end off today's show, right, I would like to put your focus into this camera here, right? Any last words, any last advice, right, to our audience out there?
Okay. My advice is that, as I mentioned earlier, start your family early if you can. Yeah. If not, try to, store your embryos if you both are married, and then they can start a family later. Or for young ladies, if you can, freeze your eggs as an insurance. You may not need it later on because you can still be fertile, but it's an insurance that will make you more reassured, and then you can carry on with your life. The most important for the ladies is that have faith in yourself, especially for those couples who have undergone IVF or about to start, because overall I understand that they always put blame on themselves. It's my fault, but it's nobody's fault. It just happened. So have faith in yourself that you can do it. All right? That's my last few
Thank you
words.
very much, Liow.
Thank you.
Thank you. And that brings us to the end of today's deep dive into the science of beginning. A huge thank you to Dr. Liow Swee Lian for sharing not just his incredible knowledge, but the heart behind his work. From frozen embryos to future possibilities, he reminded us that fertility isn't just a medical journey, it's a human one.
Whether you're a hopeful parent, or a curious listener, or someone who has just learned what a blastocyst is, we hope that this episode gave you a new appreciation for the quiet heroes behind every IVF success story. Until next time, keep asking, keep learning, and never stop believing in the science of life.
Hi guys, thank you for listening. If you like what you have just heard, follow us for more content like this.